a lot of interest, in this session. So Stacy and Kelly were fine with recording, so we're going to do that. And I just wanted to, I'm going to get it started right away and hand it off to Kelly and Stacy. But I did just want to thank you both for agreeing to do a presentation today. I know you guys have a lot of great experience and skills that you wanted to share. And I wanted to just congratulate Kelly, who I just found out passed her IBCLC exam. So any of those of you who don't know, that's kind of like the highest level of our lactation consultant work. So, and it's quite a challenge. So congratulations to you on that. I think that's fantastic. So
Thank you, Sherry.
I am going to hand off to you guys.
All right, thank you, Sherry, so much for having us. We greatly appreciate it. And for everyone that hasn't met me yet, my name is Kelly, and Stacey and I just want to thank each and every one of you for taking time out of your busy days to join us for this presentation. So this presentation, we're going to mainly be talking about finding your support and also calming techniques for mom and baby. We felt this was a very important topic that sometimes doesn't necessarily get touched on a whole lot. And also we thought it was important to talk about stress and how to manage that throughout your breastfeeding journey. We also want to keep this as an open discussion. So it's going to be a little bit different of a presentation in general. We all learn mainly from others' experiences. So please unmute your mic if you feel comfortable, or you can always put your information in the chat box as well. So we will get started, and we're going to first talk about just who we are and what we do.
Yep. So my name is Stacy Skenador, and I work within the WIC office at the Oneida Nation in Oneida, Wisconsin. And I'm the breastfeeding peer counselor here. So I've actually been here for nine years. And I guess the main things that I do in my position here are educate, encourage, and support. I educate throughout the pregnancy, prenatally and after birth. I stay with moms throughout their breastfeeding journey and educate as questions or situations arise. So I kind of stay with them no matter how long or short they go. I also encourage moms by focusing on their needs and choices. I try to encourage my clients to always be open and honest so that they can receive the best, most fitting support. And one of the ways that that I encourage them is really to ask a lot of questions. And then finally, I support them by being non-judgmental and meeting the client where they are at. I can support as little or as often as the client desires. I never want to add any pressure or stress, but I also want to make sure that the client's not feeling alone or unsupported. So it's important to support wherever they are in their breastfeeding journey, not just in the beginning. So you kind of want to be there throughout so that you're a consistent, supportive person, and they always have somebody to turn to with those questions, or just for an ear sometimes, or, you know, always to be answering questions. So, yeah.
And
Kelly?
my name is Kelly Knable. I've been working with the Oneida WIC Community Health Center as a WIC outpatient dietitian and then also a lactation consultant for about 7 months. So pretty new, but I have been working with WIC overall in the last 6 years. As a nutrition staff role, we mainly focus on providing nutrition and breastfeeding education and then also support. We do make referrals based on the family's needs at the time. And then we do provide a specific nutrition package to each eligible person in the family. And then for those that may not know about WIC or what it stands for, WIC stands for Women, Infants, and Children. It's a supplemental nutrition program for pregnant, postpartum women, and that could include breastfeeding or non-breastfeeding, infants, children up to age 5, and then WIC also serves kinship and foster care families as well. So this is just a little bit about who we are and what we do here in the WIC clinic.
Okay, so we're going to go right into our top support systems. So 3 of the main or top support systems that we could think of were definitely family and friends, environmental and peers or professional. So family and friends is an obvious and probably it makes the biggest impact on a person's breastfeeding experience. So when considering family and friends, like, does your significant other support breastfeeding? What about your parents? What are their thoughts? Grandparents, siblings, other important people like close friends, all of them are going to be, or hopefully are your main supporters. Environmentally, are you supported within your home? What about your community? Do you feel comfortable breastfeeding in your community? Is there clean water? Is there smoking in the home? Privacy, do you have privacy? Is there some place you can go to breastfeed if you're uncomfortable breastfeeding in front of others? What about, do you have other children that you're going home to? Will you have to return to work? And if so, is work a supportive environment for you? Will you have a place to pump and a time to pump? Those are all things that you need to think about, I guess, when you're considering your breastfeeding journey. Peers and professionals. So there's many different avenues you can look to for support. I, as a WIC breastfeeding peer counselor, and then primary care providers, breastfeeding coalitions, La Leche League, our local Oneida Breastfeeding Families Group, IBCs or Indigenous Breastfeeding Counselors, and lactation counselors. This is kind of where we would like people to share, just from experience, who are your main supporters? For me, I guess I'll share my experience was my grandparent, my grandma and my mom, they didn't breastfeed. So I really had to use WIC. I didn't have anybody to turn to for those questions and support that I needed. So, but eventually, as time went on, my sister was my main supporter, cheering me on and stuff. So, does anyone else feel comfortable sharing, I guess, who their main supporters are in their breastfeeding journey?
So we do have one in the chat, says coworkers and supervisor.
That's awesome.
I think that was a little, I think she's kissing up. Just kidding, Alyssa.
It works.
This is Carol, and I had my mother and friends and coworkers as well.
Thank you for sharing.
Yeah.
We have family in here as well.
That's great. So we can see that our main supporters are kind of all over the place. It's not just at home. It's definitely, we need those supports from everywhere, every direction in our life. It's important to have those supporting people. So thanks for sharing.
Absolutely. And that kind of ties into going through and then pinning those top supporters, whether it's mainly family, like a lot of you had said, your coworkers, if it's more at home and you just feel very secure at home, or calling a breastfeeding peer or support group to have those questions answered, or just feel supported in general. It's great to recognize where and who you can go to when you are really struggling. And then it's also great to understand or recognize that there's areas that could influence breastfeeding as well. And as you can see, there's a whole list of possibilities that this could be either positive or negative effects on breastfeeding. So the first one, significant other. Significant others can be very helpful around the house, changing diapers, especially in that first week, or just a simple reminder that you are doing a great job with breastfeeding when you are feeling really stressed out. Sometimes it can affect it in a very negative way of maybe the significant other feels, a little bit jealous about the bond that you and the baby have, or making a comment about when are you planning on stop breastfeeding? or maybe the significant other is a little bit jealous and wants to also feed the baby too. And sometimes that can be very overwhelming as far as an effect on your breastfeeding journey too. And just like your significant other, family has a huge role in supporting and influencing you too as well. So some positive effects could always be they're there like a mom is there always to answer your questions and supporting you and validating, you know, this happened to me yesterday. Is this normal? Yes, it's normal. You're doing a great job. Keep it up, especially when you feel like you're doubting yourself. But it could also go in, again, the opposite direction as far as affecting your breastfeeding journey. If you're not feeling comfortable with nursing around family, or if there's negative comments, that's always an influence. Parents coming and helping out the first week, which is amazing to have. But also if parents are coming and saying, oh, why don't you, take a nap, take a longer stretch of sleep. I'll take care of the baby and feed the baby. When unfortunately, sometimes that could also affect missed feedings and then decrease supply too. So just kind of thinking in that perspective as well. Living situations with multiple children, feeling like maybe you have very little privacy, or balancing trying to take care of other children and feeling a little bit stressed out. Or maybe you're constantly on the go and in the car all the time, running kids to different activities, and you're just kind of getting a little bit stressed out in that way. Personally, I know my mom had mentioned when there was 5 of us kids, so she said she was always running to different activities and she'd be nursing in the back in between and going from different places. And it can be very overwhelming at that time. Or maybe it could be more of a positive, family members helping out with other chores when you are overwhelmed. Children sitting next to you and taking their baby doll and nursing with you alongside you. I had a mom tell me her daughter stated that she started recognizing some of the baby's cues, feeding cues, and was like, Mom, I think the baby needs your boob right now. It's time to nurse. I just thought that was so cute and valued as such a support for the mom too. And then going back to work, are you feeling stressed out? Like Stacey had mentioned, are you worrying about pumping and feeding the baby, or not having enough stored milk? Or do you feel like your coworkers are starting to get upset with you taking time to pump? But it can also be valued in a very positive way. Maybe your employer or coworkers are very supportive, like a lot of you had mentioned. You rely on them as far as pumping and just being very understanding. So healing process can also affect your breastfeeding journey. How was your labor? Was it difficult? Did the baby have to go in the NICU or an emergency C-section? Were you experiencing a little bit of baby blues or postpartum depression or anxiety, maybe as a first parent? Sometimes that can affect that process as well. Or did you feel more breastfeeding and healing can help slow everything down, kind of make everything a little bit more at ease, increasing that bonding between you and the baby? Also releases that oxytocin, that lovey-dovey hormone, which reduces the pain and relaxation and feeling that stronger love for the baby. Maybe that was your experience as well as far as affecting breastfeeding. And then the last two, primary professionals, they can be very supportive and positive with different messages. Also, there could be misinformation on stopping breastfeeding and you're kind of unsure of what to do. Previous experiences or childhood exposure. So meaning, were you exposed to breastfeeding as a child? And if so, was it a positive experience or was it viewed more as negative? Misinformation on breastfeeding. For example, oh, you will never sleep if you breastfeed. But we do know research has shown breastfeeding moms actually get a lot more sleep in general. Or did you hear more positive information? Oh, breastfeeding is amazing. It just creates that wonderful bond between you and baby. And then last, previous experience can also affect breastfeeding. If you have multiple children, did you have difficulty or was it a good experience? And if so, how does this translate to if you do possibly want to have kids in the future and what that might affect or what that looks like for you in the future? And so just understanding what affects breastfeeding will help meet your overall breastfeeding goal in general. And this is where we're going to pose another question. Does anybody want to share your thoughts or what had affected your breastfeeding journey, either currently or in the past?
And again, you can either unmute yourself and talk out loud, or you can type in the chat. We've got one in the chat so far. Positive was the bonding time, having that time alone with the baby.
Absolutely.
There's one in the chat. I had a lactation counselor tell me I should just do formula for a few days. So looking at some of that misinformation you might get.
And thank you for sharing. I know that can be very difficult to hear and also make you go back and forth. Well, what should I be doing? And kind of doubt yourself. I'm sorry you had gone through that.
And another from the chat, one of the negatives that was noticed was outside influence, talking negatively about it being gross.
Mm-hmm. Yeah.
And then we just have just connecting to one of the examples you said, Kelly, that she loved seeing her daughter breastfeed her baby dolls when she was breastfeeding. So kind of role modeling.
Absolutely. And I actually hear that a lot from moms, and it's just such a cute story to share. Any other experiences or anything else anybody else wants to share? Thank you so much for sharing. And then Stacey is going to go into more of that misinformation about breastfeeding.
Yeah, so like she said, it can be hard when you're getting misinformation. You can get misinformation from family and friends. So sometimes you can feel that judgment, like you were mentioning in the comments, that, you know, you don't feel supported, or maybe your mom or grandmother, sister, or friend say things to discourage breastfeeding, like, are you sure? Or why do you want to do that? Or, oh, that's going to be really hard. Or I didn't breastfeed you and you turned out fine. Those are some things that people, you know, can really discourage you in your intention, especially when you're thinking about breastfeeding and pumping. One of the things that I hear, or a common belief that I hear a lot, is that you have to do both. I think moms go into this thinking that you got to do both, and make it so it kind of adds to that judgment of, wow, that's going to be a lot of work, you know. So it makes you kind of, you know, think, do I want to do that? So I always share with my moms that they only really need to pump if they're going to be separated, and like when you're returning to work or school, things like that, or, you know, just running errands. But another one that I hear is that pumping is actually easier. And I let moms know that pumping is actually more work than just breastfeeding by itself. I mean, think about it. There's not all that extra work that goes into, you know, cleaning and preparing, and, you know, just adding so much extra work than just latching the baby on. And then another one that I hear is that, you know, their family or friends tell them, oh man, that's really going to hurt. Like, this is probably the one I hear most frequently. They say their family or friends told them it's really going to hurt. I try to ease their mind by telling them that that's actually not normal. And if there's pain, that it's a sign or symptom that adjustments need to be made. This is where, as a peer, I will self-disclose and share that I personally went through pain in the beginning of my breastfeeding journey. And what I did was I actually came in for a WIC appointment, and my supervisor now, or my the manager here, she was doing my appointment for me and noticed that my son was showing hunger cues and said, "Would you like to feed?" And I was like, "Sure," So I went to put him on, but as I'm going to put him on, I'm like pulling away at the same time I'm bringing him in to feed, because the beginning of the latch was really painful for me. So she actually was like, "Oh," she noticed, "Oh, are you having some pain?" And I was like, "Yeah, but it, just at the beginning." And she's like, "Oh, well, why don't you unlatch him and then we can work on this?" So we did that, and she got him to latch, and like, I can just imagine the look on my face, because I was like, "Oh my gosh, this doesn't even hurt." I guess I just assumed from, hearing from other people that pain was normal, that it was part of my journey. When from there on out, I didn't have any more pain, and I didn't run into any more issues. And I breastfed my son until he was 2.5. So pain isn't normal, and you should really reach out for help or turn to support as needed with that. So another one that I hear is that it's going to be easy. Oh, moms that have an easy breastfeeding journey telling another mom, "Oh, yeah, it's going to be so easy." But, each breastfeeding experience is a unique one. Just because you had an easy time with one doesn't mean that the next journey is going to be the same exact way. Or just because you started off with a hard one doesn't mean that it's going to be hard again the next time. So one thing I always tell them is, just be patient with yourself and your baby. Like, remember that you're both learning together, and, your dedication is going to pay off in the end. So one of the questions that I have here is, what misinformation do you hear? And then how do you respond to that? Would anyone like to share?
I'm glad that you guys mentioned the going to be easy. I don't know, a couple years ago, we did a native breastfeeding survey, and that was one of the things that came up as one of the concerns that, and it was actually written questions or comments about what more information they needed for breastfeeding. And there were enough comments of the same type that it actually showed up as one of the findings from our report, was that people, they want honesty about what's going to happen. Like, don't describe breastfeeding as this magical event that everyone does and it's so easy and it's just so simple and so
Yeah.
natural and things like that. And a lot of women know that's not necessarily how it starts.
Yeah.
So I'm glad you guys mentioned that. That's definitely one that I hear a lot of. Like, let's just be honest about what are some of the barriers you may encounter initially. So
Right. I know in the beginning of my my training and my peer role, that's exactly what happened. Was I remember one client coming in, and she was in tears, and she came in and she sat down, and we were like, "Okay, are you okay with working on latch?" And she was like, "Yeah." She was, "I just have one thing to say." She said, "When I told everybody that I was planning to breastfeed this time," because she had formula fed her older two, she said, "Oh, everybody was just like, 'Oh yeah, it's going to be great. It's going to be beautiful. You're going to have this awesome bond. You're going to notice the difference, all this stuff." She goes, and she puts her head down and says, "But why doesn't anybody tell you how hard it is?" And I was like, wow, it was really eye-opening experience for me to see her share that, just how hard she was finding it, how difficult it was for her. So yeah, it's not always easy. Anyone else?
oh, there's sunshine.
Here I am. Sorry,
Yay.
everyone. Usually I'm more vocal. Got my hands full today. But as far as misinformation, I do have to say that I disagree a little bit with the from what I've been hearing, maybe recently within the last couple of years. I've had a lot of moms tell me that they do think that it's going to be hard and that it's not going to be easy, and that does discourage them in choosing to breastfeed, that they're afraid of it, and that people talk about how hard it is and how hard it is and that how painful it is, and that kind of like defers them from wanting to breastfeed. And at the same time, like social media just really puts a stress on everyone in every aspect of their life, which is exhausting and unfortunately. Okay.
Right. It's so true. It goes, it can go both ways. It's either, you're hearing that it's going to be so easy, or you're hearing it's going to be so hard,
Yeah, definitely. And you have that like in between where it's not really highlighted, where like, yeah, it's going to be hard, but we can help you get through it. Or it can be easy if, you get the right information and you get a good latch and you check for, tongue or lip ties, and just being mostly informed, I think, is a good way to figure out if it's going to be. I'm sorry, I'm just like so scattered right now. These guys are going off.
Mom life.
Yeah. And that, just if you have that correct support system in place, and knowing, you get a lot of questions on like, how can I prepare for breastfeeding? Right. Is there anything that I can do to basically toughen up your nipples or like get them ready? And that's a huge like misinformation. I think there's no, like, correct me if I'm wrong, like a real way to physically prepare for breastfeeding other than being informed and having that good support system in place. Okay.
Right.
Okay.
Exactly.
Yep. And I think you hit it right on the dot as far as like having that support system and figuring that out ahead of time can make the experience a lot like better of an experience versus one way if you heard it's really hard, or if you heard it's really easy. So you can get through that middle ground better. And that was perfectly said.
Yeah, it goes right back to that support system, knowing who you can turn to, for sure. Thanks for sharing, Sunshine.
Yeah, definitely. Thank you. I would love to share more, but yeah, it's a little crazy here today. But I really thank both of you for your time and the information. I was looking forward to this, and I'm anxious to hear what else you guys have to say. Yoyani.
Yes. Okay, anyone else?
I think one of the big things that I heard was like people are working are nervous because they hear that you have to have so much of a milk supply before returning to work. So a lot of times they end up supplementing right away because they think there's no way they're going to end up with like a freezer full of milk.
Right. Yep. Yeah, for sure. That's definitely a concern. Moms, I usually try to check in with moms a couple of weeks before they return to work. That way we can kind of discuss that, where they're going to fit those pumping sessions in, and making sure that they're staying on a regular schedule, and then, going through the milk storage guidelines and things like that. So it's always good to have someone to turn to that ask those type of questions too. There's a lot of moms that have to go back to work, and feeling supported is key when you have to be separated from your baby. So thanks for sharing. All right, anybody else? Okay, so now we're just going to talk a little bit about, being honest and advocating for yourself. Oops, sorry, back one slide here. All right, so the main thing for me is to be honest. Be honest about your goals. The best way that you can advocate for yourself is by asking questions and then making the best decision for you based off what you have learned. So don't always go off of what everyone else says. You need to think about you and your family's needs. Always make the best decision for you. Be honest, because that way you'll get the best information and support to help meet those goals. Be realistic and set attainable goals. If you can dedicate yourself to breastfeeding for 1 day to start, 1 hour, that is okay. It feels great to meet a goal, no matter what that goal is. And then where are you in your journey, considering, did you just give birth? Are you returning to work? Is the baby teething? Are you going through a nursing strike? A growth spurt? Did you just introduce solids? Or is your baby a year old and beyond? No matter where you are in your journey, you're gonna need support. So at any time in your journey, you can ask for help or advice. It goes back to that, having that great support system and needing that support throughout your breastfeeding journey, not just in the beginning. So this is one that I struggle with, I guess. The question that goes along with this slide is, how do you get your clients to be honest about their intention? Or for moms, is it easy for you to be honest about your goals or intentions with breastfeeding? I know it can be difficult when you're feeling lots of pressure considering your choice of feeding method. So I know everybody here is advocates for breastfeeding, but some moms feel a lot of pressure to breastfeed, and so they'll tell me. I find them telling me what they think that I would want to hear, but I really want them to be honest with me. Even if they say, I don't want to breastfeed, that's okay. But how do you guys get, or how easy is it for you to be honest about your goals, and how do you support that?
And again, feel free to take yourself off mute or do a chat, whatever is easiest for you.
Me again.
All right.
Yeah, I think that personally, for me, I appreciate the honesty coming from the person who is trying to support me. A prime example is me looking for support and being lost on what I should do next or how I could get help from a clogged duct and mastitis, and thinking that, I had already been through this a couple times before previously, and I've never experienced anything like this before. And I thought maybe, hey, I should have this all down packed. What do I need to ask anyone for help for? I felt embarrassed that I just personally didn't know what to do or even how to ask for help. And Stacy is a great and amazing peer breastfeeding counselor, and she made it comfortable for me to ask for that help and get the support that I needed. And it's not always, comfortable asking for help, and you do feel vulnerable, and it's just human nature to be embarrassed about anything, and that feeling of being judged. And I think that what made me more comfortable was on a more personal level, that Stacy had shared something personal with me about herself and her breastfeeding journey, which made me think that, okay, she's a real person. She genuinely cares about me. And I think that sharing those personal experiences with your clients makes them feel more comfortable and feel that they're in that safe space, and that they're able to tell you their realistic goals and seek that help that they need. And also a big bonus for me was Stacy's also Native American, and she's also Oneida, and we come from the same community. So that's a huge one for me personally. And on another level, like you do want to go to your local WIC office, you know, if you have nowhere to turn to, or if you don't have those friends and family as support and you just don't know where to go. I feel like they're always open, willing to help, but at that same time, it's important to have those brown faces in the community, and it literally just makes you feel more comfortable. No disrespect to Kelly or any of the other ladies in the WIC office, but you do feel a better connection, and you feel less judged, and that's just how society is, and that's just the world that we live in. But I think that a good thing would be for those other providers that are non-Indigenous would be to, you know, share those personal experiences and make everything just, I know you want to keep that boundary and that professional aspect of your job, of course, but also just letting people know that you're also a human being, and you've gone through certain things, and people make mistakes all the time. Just giving the people that safe space to open up to you so that you're able to help them and their families in the long run.
Well said, Sunshine, and thank you for the kudos. Yeah, so it can be really hard when you're feeling judged by other people. It definitely, you need to have somebody who you're comfortable with. And I think in my role as a peer, one of the main components was to bring somebody in from your community, somebody that looks like you. So obviously it's working. With Sunshine sharing how she felt in her experience working with me. So anybody else want to talk about being honest about goals?
I'm not sure if this fits, but this is a situation that Amaris and I up in Red Cliff had in the past month, where we really thought a mom was planning to breastfeed. We got the impression that was really her goal. But then she came, when we had contact with her after baby was born, she said that the lactation consultant at the hospital told her baby's mouth was too small for her nipples, so she couldn't breastfeed.
Oh.
And of course we're like, she told you that?
Yeah.
You know, trying, and ultimately, you know, we had kind of this discussion, Amaris and I, you know, do we really think this, you know, like, where is this mom in her process? Is this just her, and I don't want to say excuse, but, you know, is she just trying to push us away, giving a reason so we'll leave her alone? And Amaris ultimately had more conversations with her and reached out to the lactation consultant and things like that. So it was obviously, she wasn't ready to be honest with us about what her intent was. And so, you know, we just kind of did our best to correct the information and get her what she needed. But ultimately, it's a really fine line. You know, you don't, like, I think Stacy mentioned early in the session, we don't want to pressure anybody. We just want them to have the information and help them reach their goals, not our goals. So
right.
It's really a fine line. It can be a really difficult process.
Yeah, you know, in our office, I find that a lot. I always go to check in with whichever RD is assigned, because there's several RDs here. So I work with many clients, and they each are assigned to a different one. So what I do is check in with the RD that is assigned to whatever client that I'm working with. And a lot of times there's conflicting, you know, intention, or, you know, yep, they said they're going to breastfeed, you know, or, you know, they're going to fully breastfeed or whatever. And then they come into my office and they're like, well, you know, and I try to always tell them, you know, just be honest with me. Like, I'm not here to judge you one way or the other. I just want to get you the best support that, you know, that's going to help you the most. It doesn't matter to me if it's for breastfeeding or for formula, like you want the best information. So to me, honesty is key, because I don't want to be giving you all this, breastfeeding information, which just adds to the pressure. If you're really not going to breastfeed, like I don't know, like I don't want to waste their time, I guess. If they're really on the fence and they're feeling too much pressure from, because I know moms think, well, everybody says, that breast is best, or, breastfeeding is best. And I try to remind them, you have to do what's best for you, what's going to work for you. So even like I said in the beginning, if you just do it in the hospital, if you just do it for that first hour, if you just do it for that first day and you meet that goal, that feels amazing. Like, so just to be honest about, where you're at, and like, it's just so important. I just feel like you get the best support if you can just be honest about where you are, I guess, with your breastfeeding intention. Anyone else?
Stacey, I think that ties in really well to what Sunshine had mentioned. It sounds like just like validating the person's feelings really helps set that honesty and allows that to be an open discussion. And also sharing that personal experience can make it feel, oh my gosh, this is normal. I guess, it's okay that I am going through this as
Right.
well. So I think that's a great
For sure. Like, it's definitely something that you have to consider is, like we are talking about earlier, their home environment. What are they going home to? Do they have 5 other kids? Like, and do they think it's going to be harder, or do they think it's going to be easier? I mean, your environment plays a key role, in the community as well. Do you have places that you can go? Is there support out there for you? Like, yeah, so being honest, it can be really difficult for some people. And so I just try really hard to, to encourage honesty so that I can give them, I guess, the best support, or give them the best information that's going to help them the most. So anybody else? We did want to say, Sherry, that this was more of like an open discussion, like almost like a forum. And I know it's getting close to the time. We're about maybe halfway through. We can always pick this up at the next meeting time if everybody wants to do that, or we can continue going. It's completely up to you guys, but we would, continue in much the same way that we are right now. We're continuing to ask questions and kind of learn from each other and sharing experiences and things like that. So it's completely up to you guys, but we kind of were wondering if we were going to run into this time, crunch. And so it's completely up to you guys. We can kind of try to get through these last slides in the next, 10 minutes, or we can stop now and then pick up at the next scheduled meeting.
So we've already got some thoughts on it, liking the idea of continuing the next time. So there's plenty of time for the rest of it and not rushing anything.
Yeah.
And I don't know, is there a kind of a break that makes sense? Like, is the calming techniques maybe something we can hold off on till, or?
That would probably be the most appropriate time to cut it off. So then it's like more of the support and then going right into the calming. I would agree.
Yeah. How does that, is there anyone who objects? I'm not thinking anyone will object. So why don't we do that? Because I think the conversation, if you have more that you'd like people to participate in, that's been going really well.
Yeah. This is what we were hoping for, because I like to learn from other people too. It's really nice to get everyone else's stories and what's working for them, so that, you can kind of use it in your own too, as you support the breastfeeding people around you. So then, yeah, we'll pick it up next time. I guess Sherry will send out the information. Did anybody want to add anything? We got like 10 minutes or so left. Anyone want to add anything to being
Stacey,
honest?
Oh,
Mhm.
sorry. I think we're gonna continue doing the next couple slides, and then once we hit to the
Okay.
volume, and I
Okay,
think that should give us enough time with
yeah.
it.
Okay, so
Okay.
let's just go to the next slide and then we'll we'll see where we're at.
Okay,
I
sounds
love
good.
the flexibility. Hey, this is the way it
Yeah.
works, right?
Yep, absolutely.
Okay.
So this actually just ties in perfectly with advocating for yourself. So just as advocating for yourself, giving yourself that permission is just as important. So looking at the first row of boxes, sometimes all of this can go on. Maybe one of them goes on during your breastfeeding journey. Maybe you feel so exhausted or lack of sleep or overwhelmed or anxious about being a first-time parent. For example, if you can't even remember if you changed the infant's diaper and then you're rechecking multiple times because it's like, oh my goodness, I can't even remember what I did. Or your infant is cluster feeding and it just gets very overwhelming with different feelings of feeling like baby's on the breast all the time. Maybe you have feelings of isolation or feeling alone. For example, a family member, a significant other makes very negative comments that just makes you feel neglected or isolated as an individual with that. So allowing yourself the permission of your feelings of being stressed, overwhelmed, or alone can help recognize, okay, I am feeling this way and it's okay to feel this way. And then this allows you to process it and then move on into finding a different way to either calm down or maybe finding your top supporters that you need to be able to get the right support and help at that time. So Stacey and I wanted to share a video that I thought it was perfect for describing the overwhelmed feeling and what a breastfeeding mom goes through. Sherry, you had mentioned it perfectly before of, that middle ground that never really maybe gets talked about. Breastfeeding is great, but there's all this middle stuff going on that can just be very overwhelming with your experience. So this clip that we're specifically showing, I just want to do a quick statement that we are not associated with promoting the Frida product specifically. It's just purely the content of the video. Enjoy.
Okay, so wish me luck here.
Oh, you're gonna do great. Oh, I don't think it transferred. You might have to stop sharing the screen and then reshare it.
Much better. And oh god, a much. And draw. And how does anyone ever drink enough water? It's too early to call a lactation consultant.
Stacey, do you want to pause the video and then rewind? You might have to stop sharing the presentation and then reshare it to the video, I think.
Are they not seeing the video or what?
No, we're not.
Okay.
I think if you stop sharing this one, it should bring up the option to share the YouTube one. And then you can share that one, then it's just a lot of finagling, but.
Okay, Kelly, I might need your help here.
Okay. Otherwise, I wonder if I could share. Do this and then. Can you see it?
Yep,
Hopefully it works. Fingers crossed.
Okay.
All right.
you got it.
girls.
Yep.
Just have to stop sharing again and do that process.
Latch. And latch better. And oh god, a much. And draw. And how does anyone ever drink enough water? It's too early to call a lactation consultant. And he's still crying. And do I love my baby? That long if I stop now? Goodness, you know how to do this. 3 a.m. or 6 a.m. and 4:43 a.m. and I'm so tired and clog and work out the clog with my what? cluster feeding and so much milk, and the pump is talking. And my doctor said cabbage and not enough milk. And what even is enough milk? And I just want to feed my baby. So I said, Nicole, will these ever go back? I love the smell and wrinkled toes.
And I do have the link for that. I might share it with the notes.
My cousin actually ended up sharing this, and she just briefly told me, she's like, oh my gosh, this video just speaks to me in so many different ways. And I was like, oh my gosh, this is perfect. Thank you so much for sharing. And I just thought it resonated so much in what I feel like breastfeeding moms go through, or thoughts and feelings. And actually, does anybody want to share their thoughts with the video, about the video? Yes.
So we have that was so realistic. Love the popcorn clip. So if you didn't notice, she ate the popcorn off the baby's head.
Okay, let me see if I can get back. Kelly, I might need your help again. Let me see here. No, yeah, it's going back to the. It's going back to the.
Okay. If you click that share screen, and then there should, yep. And then we can do the presenter mode.
Okay.
Did it work?
We're seeing it again.
Okay. Okay.
Any other thoughts on the view before I move on? So kind of checking in, tying into that video of feeling overwhelmed, this is a great tool to quickly check in with yourselves. And it's a scale of 1 to 10. So 1 being meaning that you're really content, you're good, everything's going pretty well. And 10 meaning you are very high stressed. You feel like you're gonna pull your hair out, you're so stressed. So today, I would like everyone, let's just check in with yourself. So where do you fall on the scale of 1 to 10 today? Are you a 1 to 3 where you're content, very little stress? Or are you about a 4 to 7? Maybe you caught your bag on the door handle and dumped liquid all over the place, and you had to take time to clean it up before you either went to work or out and about. But nothing that you can't handle. Or are you more of an 8 or 10? Your heart is just constantly racing, and you keep having these negative thoughts, going over and over in your head, and you just feel like you've reached that limit. So knowing where you are on that 1 to scale and kind of checking in with yourself, it just, again, allows yourself to give yourself permission to your feelings. And then it also helps move towards what you need to get that number lowered. Either if you're at 5, how can you get to that 2? And does anybody want to share where they are on the scale or thoughts? I can go first. So today, giving presentations, I think anyone can say this, is a little intimidating and scary to do. So I was definitely either a 6 or 5. But I do feel like I'm come down to a little bit of a 3. So that's pretty good. Where's everyone on the scale today?
Well, I'm the same. I'm right around, with all this technology stuff, it's like I'm kind of probably at a 4 or 5 or whatever, but as things move along, I'm kind of going down toward a, 2, 3. So
That's great. That's good.
We got another 4 to 5 range in the chat.
Thank you for sharing. Anyone else would like to share? Thanks.
Oh, and just so you can know, you got a little kudos there. Great job with the presentation.
And I believe this is where we'll actually leave our presentation until next time.
Okay, sounds good. Did anyone, before we close, did anyone have any questions about this first half that they wanted to get, they wanted to ask? Oh, and I see Sunshine just sent me a 6.5. As we saw her kind of trying to do 6 things at once there, we can understand.
Yes.
Right. Yep.
Any other questions before we close? Otherwise, we will get a date and get some new information out for you so we can do the second half. I just want to say thank you to you guys. This was great. I really love the interaction and getting people to talk about their experiences. You're getting a lot of claps and or high fives or whatever those emojis are. But really appreciate the time today, and we will look to do a second session coming up soon. So keep an eye out for that. And before I close, any last questions, comments?
Thank you everyone for sharing their experience. We
Yeah, thanks.
really appreciate it.
Thank you.
Okay, well, everyone have a great day. It's looking like it's going to be a nice week, so try to get out and enjoy the sunshine, and we'll talk to you again.